Hi, my name's Elaine. I'll be teaching you the proper way to check for the apical pulse and the radial pulse. So first things first, you want to make sure to always do the proper hand hygiene. Super important. You want to make sure to always do the proper hand hygiene. Once you've done proper hand hygiene, you want to provide privacy and identify the patient with two identifiers, such as their birthday and their name. Once you've identify the patient, you want to go ahead and introduce yourself to the patient, and you want to greet the patient, and you want to let them know what you'll be doing with them today. Another thing is, before you get started, you want to make sure you have fully sanitized your stethoscope. It's super important to sanitize it before and after every use. So then you want to gather a few informations. You want to make sure you know if your patient either has any disease, a fever, or anything that could cause an abnormal heartbeat, such as age, disease, heart problems, any of that matter. You want to make sure you know before checking the heartbeat. So now I'll be going ahead and show you how to do the apical pulse. So you want to go ahead and get your patient in a comfortable supine position. You want to find the PMI. You want to also explain everything that you're doing to the patient. So the PMI is always usually about an inch or an inch and a half below the nipple. You want to expose the left area of the patient's chest. So you will have to find exactly where the PMI is at. So the PMI, you need to find for the angle Louise, which will be right below the notch. So once you find the bony premises called the angle Louise, you want to go ahead with your fingers, press down until you find the second intercostal. So you have to press down. Once you have the second intercostal, you want to go ahead and slightly move to the left, and you want to move down to the fifth intercostal. And you'll move to the second line in the premises of the chest right here, which should be right below the nipple, usually should be. So once you find the exact PMI, you want to go ahead and get your stethoscope ready. You want to warm it up with your hand, place it on the patient. In order to count the heartbeats, you want to count starting from one heartbeat. With your watch, you want to make sure to start at an exact even number, or an odd number. So you want to make sure that you're counting for a full minute. So the first heartbeat should count, and you want to count for 30 seconds. Once you counted for 30 seconds, you would want to multiply that number by 2. The reason why you would count that number by 2 is because in a full minute, a patient should have about 60 to 100 heartbeats. That is the normal range. Therefore, if you count 30 seconds and multiply that number by 2, you will get the exact or near the exact number of heartbeats the patient is having. You would want to after you've done that, you want to go ahead and tell the patient what their heartbeat is like and that everything is normal, or is there something concerning that you should worry about, maybe like an abnormal heartbeat, either it's over or below the range. You don't want to note down any observations to the nurse and let them know that you noticed below average or above average heartbeats, or if you maybe heard a skipped heartbeat or anything that was very abnormal, you want to tell the nurse at once. Now I'll tell you the proper way to check for the pulse, which is called the radial pulse. So the radial pulse, you want to put the person's forearm straight down. You want to get them in a comfortable supine position and put their forearm straight and relaxed on the bed. Or if they're sitting up, you want to put the forearm on the armrest. So I'll go ahead and show you guys on my hand instead of the patient's, since it doesn't have an actual wrist. So basically you would want to grab the patient's wrist. It should be facing down, and with the first 2 or 3 fingers, you want to go ahead and you want to go through the thumb's groove line. You want to go right onto the wrist, but like you want to follow the thumb right below the wrist. So once you've got right here, you want to feel the strongest pulse. Once you feel the strongest pulse, you want to kind of add a little pressure right there, and that is exactly where you'll find the radial pulse. So I would find down the patient through the thumb groove line, and then I will add a little bit of pressure here, and then this is how you'll check the person's pulse. And that is all. Thank you very much. And then one more thing, you always want to make sure to provide the proper hand hygiene after taking care of the patient, and you want to make sure to sanitize your stethoscope right after every single use. It's super important. Thank you very much.